Today, we've had a number of different speakers here at the conference, and it's been truly amazing. It's kind of opened my eyes and offered me a very unique education as to all the different factors and drivers going into the future of pediatric dentistry.
I was able to get the views of many different people from other areas of pediatric dentistry outside of just the clinical setting. And I'll be going home with a lot of different ideas and thoughts about how this industry is sort of transforming itself as time progresses.
I think it illustrates that the whole country as a whole is moving towards preventative care with everyone insured. And I think once the arguing about the politics eventually subsides and everyone just accepts that the Affordable Health Care Act is going to come or some kind of form of that, we can figure out what's the best way to appreciate it and use it for preventative care, because it is much more affordable for preventative care as opposed to restorative care, which we can see.
It's important we put our money where our mouths are, literally, and be funding this prevention.
All of what's happening before the child actually comes to you with the cavity, it's happening outside of your control. And there's so many factors that go into the child buying that piece of candy and eating it all day, or drinking chocolate milk, or strawberry milk, and having all that sugar on their teeth. All of these things in society that, these parents making decisions, the children making decisions are outside of your control, and you don't have as much interaction with that world that creates that to really make a difference. It's consumerism that's really causing all these decisions to be made that you don't always have the dentist in your mind, you don't always have cavities in your mind.
I'm hoping that with the Affordable Care Act, that will kind of bring more of an emphasis back onto prevention.
So the knowledge of prevention is just overall safer for the child as a whole.
It's important that we be funding, all these things we talk about prevention and, helping these medically compromised patients, that we're actually putting our money where our mouths are and really making a difference there, I thought.
I mean, the prime source of what we're dealing with is what's being put into the mouth, and they don't even think about it. So I just think this is just something that's really needed in our profession, is talks like this, and people that are really experts in the field and know the research and know the stats to tell us, hey, this is what's going on. Now your direction is to motivate the parents to really listen and really be watchful in the grocery stores, really be watchful with every decision that they make for themselves and their children.
I really enjoyed Dr. Lustig. She mentioned the non-dental providers and what their motivations are, their insights, and the one that stood out to me was the pharmacists. How many people are talking to our pharmacists and saying, I have a toothache, I have this problem, I have an ulcer, and it has never occurred to me to go to them, ask them what they know, what they need from me, become a source to them. And I should be going home probably this weekend and doing just that.
Oral health insurance, which obviously we're most interested in, it would be not mandated on the exchange, but mandated off the exchange. And I think that's kind of an interesting thing that hopefully will be changed quickly.
I liked seeing not only the evidence-based research, but its application within the school so that you can take sealants to their maximal potential, using them on those early non-cavitated lesions for the patient's better health.
I enjoyed all the speakers for different reasons. Dr. Fontana was very interesting because of all the different research that she brought up and new ways of thinking of how to approach, especially children. Not all children are the same, and different ways of management, and just new philosophy that we learn. It's very different than what you learn in dental school. And Dr. Lustig would, again, kind of illustrating the different mid-level providers and seeing, and also again the philosophy that there's no one model that applies to everyone and everywhere.
The whole notion of introducing other providers that are involved in treating the decay process and sort of working with pediatric dentists to increase the access of care for children in underserved areas, that that was a subject that gets me a little bit nervous sometimes, but it did make sense that because of such a need in certain communities that everybody sort of comes together, and I think the speaker did a very good job addressing those issues.
We're talking about how pharmacists are part of the whole new, other kind of non-dental provider, and in the future, and actually going on right now, there are Walgreens or Walmarts, they're opening up, their own clinics, and now how is that going to affect pediatric dentists? There are a lot of, they're opening up their own clinics and they're having medical providers, but how do dental providers, figure into that equation in the future? And it's just wonderful, these are just kind of one of the questions that get stimulated by this kind of conference, and it's just wonderful that we could really get a view from all different types of people, not just dentists, but CEOs of insurance companies, podiatrists who are involved in offering non-dental professional assistance to the dental community. So it's been truly amazing, and I'm glad I was here for it today. Thank you.